So, good morning, everyone. It really is a pleasure to be here and certainly to be part of this important recognition. And it is my privilege, actually, to bring on behalf of the Canadian Nurse Association some remarks, which, for those of you who don't know, the Canadian Nurse Association is the national professional voice for registered nurses. Today we are here. We are all marking an important milestone, the second anniversary of the Supreme Court of Canada ruling that allowed Insight to remain open. The supervised injection facility, which was set up to respond to public health crisis, has clearly had an impact. And how? Well, by providing vulnerable population with improved access to health and social services. The Supreme Court decision 2 years ago today was a victory for harm reduction and for the client who rely on Insight. Like many of you, nurses throughout Canada celebrates the decision. CNA, together with the Provincial Nursing Association in Ontario, as well as the BC Association, had been granted intervener status and presented in support of Insight before the Supreme Court when arguments were heard. For us, the court's decision was indeed positive, as it is essentially put health first. The decision also touched the nursing profession directly. Registered nurses, regardless of the setting in which they work, frequently cares for people experiencing the impact of substance abuse. And you can imagine providing nursing care in the context of substance use, particularly illegal substance use, can raise questions and issues for registered nurse and impact the provision of care. And it is important to address the concern that are, being expressed, because I think that's how we can make and really build on safe measures. The Supreme Court ruling gave Insight constitutional protection to operate. Without this protection, nurses and other staff would be exposed to criminal charges for simply carrying out their ethical and professional obligation to care for their patients. And we know that providing users with evidence-based information for self-administration of injections is within the scope of practice of RN and enable them to deliver the essential care they are trained to provide. CNA is here today to join your effort to bring it to light and show the support for an effective approach for addressing addiction. We believe that harm reduction, including supervised injection, really is an essential tool in a comprehensive healthcare strategy for substance use and addiction. Supervised injection service offers a safe place to inject with sterile equipment and supervision. This promotes health by preventing disease transmission and reducing complications from drug overdose. And supervised injection services connect the drug user to other programs such as addiction counseling and treatment services, housing, and other health and social services. People need all the support they can get, and I've seen by experience that trust gets built by that relationship that gets established between the registered nurse and the person using the drug. And that's how we can do preventive approach and really reach out to people. So today, as we commemorate the Supreme Court ruling, I think it's fair to say there are many lessons to be learned from Insight. One is that addiction is clearly a health issue requiring a public health approach that is well grounded in research and that produces tangible benefit to the community. Two, we need to see more measures that open doors, not put up barriers to prevention and treatment services. And 3, it is time to put harm reduction back in Canada's drug strategy. Thank you very much.